All right, we'll convene this meeting of the Board of Health Friday, April 4th. At this time, I'm John Strand, acting as interim chair because we have elections and activities coming today, which will result in a formal chair appointment. But thanks everybody for coming and for being here and for your service. It's really important work that we do. So at this point, we'd like to go around and just introduce people and the board members and staff to the community and to each other, and then we'll go forward from there. So let's start with introductions, going over here, please. I'll back up. Let's do a roll call first. People are nodding their heads. Thank you, Commissioner. Who will conduct the roll call?
I will.
Okay, thank you.
Andrew McLean,
Present.
Abish Nagpal,
Present.
Bernie Dardis,
Present.
Grant Severson,
Present.
Jamie Steig,
Present.
Jim Capitan,
Present.
John Strand,
Present.
Meg Forty,
Present.
Valentina Aceto.
Present.
Thank you.
We have three new members today. If we could just focus on the three of you for the moment, tell us who you are and your names and a little bit of your background, and so we all know who you members are. We'll start with you over there. Okay.
Hello, everyone. I'm in the person of Asiedu Valentina. I have an MPH from North Dakota State University. I'm originally from Ghana, West Africa, and following my graduation from NDSU, I've been in the role of Refugee Health Navigator with Global Refuge. Yeah, that's a little bit about me.
Welcome.
Nice to meet you all. Thank you.
Good afternoon. My name is Meg Forty. I have my master's degree from NDSU in nutrition and exercise science. I'm a registered dietitian. My background is in clinical research local to the area, and I'm very excited to be here today and meet all of you. Thank you.
Hi, Andy McLean. I went to medical school at North Dakota. Did my residency in Madison, Wisconsin. Had my MPH in University of Minnesota. A number of years ago, I was the medical director for the North Dakota State Department of Human Services, and currently I'm the chair of psychiatry for the medical school and also the associate dean for wellness. Happy to be here.
And just for the record, for people to know, we had a bunch of applicants for the Board of Health position. We ended up interviewing 4 candidates, but there's other people on that list will be very capable going forward on our bench, and we'll have others in the future when any openings surface that we already have a trough of people to call on. Okay, and thank you all for applying. Now let's go around the table. We'll start with you, Dr. McLean, and just bear with me, but basic introduction so everybody knows who's all up here at the dais.
So what else would you like me to add?
Oh, just remind us again who you are.
Okay, so so I'm born and raised in North Dakota. My dad was a country doc. I thought a lot about doing that, but ended up getting a job as a psych tech and loved psychiatry. And so I've been in public health for my entire career.
Thank you.
My name is Jamie Stagg. I'm a pharmacist with a background in pharmacy practice and healthcare quality improvement.
I'm Grant Severson. I'm a pediatric rheumatologist here in Fargo. I grew up in Jamestown, went to UND, did my training in Wisconsin as well. I'm the subspecialty department chair for the pediatric subspecialties at Sanford. I'm heavily involved in the NDAAP and some national advocacy organizations.
Avish Nagpal, infectious disease physician at Sanford. I've been here about since 2007 when I started doing my residency at what was then Medicare and UND.
We'll go to Mayor Jarvis.
My name is Bernie Dardis. I'm a retired businessman here in the community, and I serve as the mayor of West Fargo.
Jim Capitan. I'm commissioner for Cass County Commission and also on the board of the Municipal Airport Authority. Retired Air Force Air National Guard for 38 years and retired City of Fargo employee for 42 years.
Hello again, I'm Meg Forty. I'm a registered dietitian from North Dakota State University, and I grew up in Mandan, North Dakota, but I have lived in Fargo since about 2008.
Hello, everyone. I'm Asied Valentina. I'm from Ghana, West Africa once again. That's where I grew up all my life. And one may ask, why am I here today? I came to North Dakota for grad school to study Masters in Public Health, and following which I'm currently the Refugee Health Navigator at Global Refuge. And I've been in Fargo, North Dakota for the past 4 years. So thank you.
Okay, thanks, everybody. Bear with me as I'm working through our agenda and trying to not miss steps here, but our next action is election of officers. And how do you want me to do this? Do you folks want to explain this, or do we just, what would be? Okay,
The two positions that are open for the election of officers are the chair and the vice chair positions. Those duties are listed on your screens. And if you would like to open nominations, I guess, Commissioner Strand, if you would want to call for nominations, and then there would be a vote thereafter.
okay. Does anybody have any questions about the role and responsibilities of chair or vice chair at all? All right. That being the case, I will open the table for nominations for the chair of the Board of Health. If anybody would like to nominate, this is your moment to advance potential chair candidates. So I'll receive nominations for chair. Where's anybody who wants to do it? Don't be shy. North Dakotans, people around here, we don't volunteer easily, but this is, Jim Capitan?
Thank you, Mr. Chairman. I'd like to nominate Mayor Dardis for chair.
We have a nomination for Mayor Dardis. Are there any other nominations?
I would like to nominate Acting Chairman John Strand.
Are there any other nominations? Are there any other nominations? At this point, we would have a vote, would we? And how would we conduct that?
I'll perform a roll call vote. I will give you the name of the first nominee, who is Mayor Dardis, and then I'll go through and say either aye or nay if you want to vote for him.
And can you vote for more than one?
Yes.
Okay.
Andrew McLean,
Nay.
Avish Nagpal,
Aye.
Bernie Dardis,
Nay.
Grant Severson,
Nay.
Jamie Stagg,
Nay.
Jim Capitan,
Aye.
John Strand,
Aye.
Meg Forte,
Nay.
and Valentina Acida.
Nay.
Okay.
Okay. At this point, we have one other nomination, me, as acting chair. Will you conduct that vote, please?
Yes, I will. For John Strand, Andrew McLean,
Aye.
Avish Nagpal,
Aye.
Bernie Dardis,
Aye.
Grant Severson,
Aye.
Jamie Steig,
Aye.
Jim Capitan,
Aye.
John Strand,
Aye.
Meg Forte,
Aye.
and Valentina Aceto.
Aye.
I owe you one, Bernie. Just so you all know, this will come out in the wash at some point.
The definition of a winner and loser here is very close, and I think I'm the winner. So you'll do a wonderful job for us,
Well,
John.
you know, and I'm honored to carry this hat, or wear this hat as the chair of the Board of Health. And my role is to serve all of you and to serve our people and our staff and our people that deliver what we do for public health. But I'm honored, and please don't hesitate keeping me in line and being honest and candid with me. You'll also find that there might be moments where I remind us of of legalities like public meetings, transparency, notices, quorums, and things like that. But the main thing is don't hesitate communicating with me so I can do my best serving you. I missed a step. Could we please introduce all of our staff to each other and us and to the public, please?
We can. Would you like to finish the elections?
Oh, we have one more to do, don't we?
The vice chair.
See how good I am already? I'm cutting the meeting short.
Sorry, Chairman.
Let's open nominations for vice chair then.
I nominate Dr. McLean.
Any other nominations? Are there any other nominations? Are there any other nominations? If not, I would call for somebody to make the motion to cast a unanimous ballot.
I'll make the second.
Moved and seconded. All those in favor of casting a unanimous ballot for Dr. McLean to be vice chair of the Board of Health, say aye.
Aye.
Any opposed, nay?
Nay.
Dr. McLean, you're hitting the road running.
You know, when I was asked to vote first for Bernie, I thought, oh my gosh, okay. He's back at me.
No, no, sir.
It's called poetic. All right,
Before you move on,
absolutely.
I'd like to take this opportunity, having served on this board a number of years, to thank the former board members that served during very difficult times. They led us through COVID, and they led us through some other interesting dynamics that took place within the city of Fargo. And the leadership of the other board members that were here, particularly our chairman and vice chairman, was extraordinary. And I'd like to say thank you for them, for their service.
It goes too easily by where people don't get thanked for their work and their public service. And it's easily said it's a thankless job, but it's important work. And it takes courage at times and steadfast focus on your values. So appreciate that, Mayor Dardis, because they all need to know. And we had 3 positions vacate, and now we have 3 members, and they need to know we appreciate what they did.
Yes, sir.
Very much. Okay, now we can introduce staff. Out of order, but we'll continue if we could.
I'm Jen Fall, the Director for Fargo Cass Public Health.
Melissa Parilla, the accountant at Fargo Cass Public Health.
Lori Sal, the Principal Office Associate.
Jesse Lindeman, Health Officer.
Holly Scott, I'm the Public Information Officer. Beth Wigman, Assistant Director of Human Resources.
Kim Vance, WIC Program Director.
Grant Larson, Director of Environmental Health.
Brent Niemeyer, North Dakota Department of Health, Director of Field Services.
Jenna Belkey, Department of Health, Field Epidemiologist for Cass County.
Suzanne Schaefer, Director of Nursing.
Good afternoon. I'm Larry Annenson. I'm the Director of Health Protection and Promotion at Fargo Cass Public Health.
Jan Eliason, Director of Harm Reduction Programs for Fargo Cass Public Health.
Brenda Derrig, Assistant City Administrator.
Nancy Morris, City Attorney.
Did we get everybody? All right. I'm a little rusty, but bear with me. I'm following 3 different pages to track today's agenda. But as I understand, and thank you all for being here and for introducing yourselves and for the work you do. Next, I will entertain a motion to approve the agenda that we have in front of us for today's meeting. If somebody would so move, I'd appreciate that.
Motion approved.
Is there a second? Moved and seconded. All those in favor say aye.
Aye.
Any opposed, nay? Okay. Next, let's approve the minutes of the January 10th meeting as presented. Is there a motion to receive them and approve them?
Move to approve.
Thank you. Is there a second?
Second.
All those in favor say aye.
Aye.
Opposed, nay? Okay. Health officer announcements. How do we approach this, Jen, or how would you suggest this unfold? I think it goes to you anyway.
Correct. We're going to go through announcements and then the health officer announcement.
Announcements, perfect. Thank you.
For announcements, I'd just like to bring up to speed what has been happening within Fargo-Cass Public Health and those things that are still upcoming. We received a food grant, MCH Food Block Grant, and with that, we are hosting a garden at a local elementary. And last week, the health promotion staff, Cheryl Stetz and I, went to plant seeds with about 50 fifth graders over their afternoon hours to do so. And when the weather permits and spring is actually here, we'll be planting a garden outside that will have their first harvest and then also have a second harvest garden when school resumes in the fall. So they'll be moving plants outside and they'll be taking care of them in their classrooms now and watching them grow. In that same grant, we were able to support the food towers that were purchased in this grant last year with additional supplies for 5 individual daycares to have hydroponic food towers growing in the kits that were necessary to do that, and then some veggie peelers and other kinds of fun things for kids to be able to participate in healthy food snacks and such. So that was an exciting new opportunity, and we look forward to expanding on that in years to come with other schools. We will be hosting a bike rodeo for the first time. This is a work also that comes out of the Health Promotion Department with Cheryl Stetz, and we have been partnering with Bike Walk North Dakota to host this bike rodeo. We're hoping for up to 300 kids with the bike rodeo within the parking lot. It's on a Saturday. There is a rain day for May 3rd, and we'll be hosting some other activities at the parking lot as well. For this event. So looking forward to having some fun with kids where they'll have their bikes fitted, their helmets fitted, and work on some summer fun safety. We have an immunization campaign that launched last week, Wednesday, with multiple media supports, and Dr. Lindemann, Cheryl Waverin, and Holly Scott worked many hours in the development of that. So happy to have that out. You'll be hearing that on the different promotional stations soon, if not already. We've been doing outreach to the arbors, which is only 4 blocks away from us, roughly, but within the arbors, there are roughly 64 kids, and sometimes it's just harder to get kids down to our center, so going to them, our nursing department, our clinic department has been going to the arbors, and we will continue to do that on a monthly basis, and continue to look at other ways in which we are expanding into the community as well. We have a Credible Mind platform as residents of Cass County. I'm not sure if you're all aware of it or not, but we have a platform that is for mental health, and it is something that the National Association of City, County Health Officers, health offices uses. The Southeast region has 6 counties that we partner with. Several of them had this platform and several of them did not. Fargo-Cass did have the platform. We decided to merge this into a Southeast Region North Dakota platform with Credible Mind, so that there will be a landing page that will bring all of the people to one page, and then if resources aren't in Ransom or Richland County, maybe they could be found within Cass County, so it's still going to be like a one-click center for them to go to. Within this platform, we're also going to have QR codes developed for business card size. So first responders would be able to hand this card to somebody in an emergency situation, whether that's an ambulance, fire, police officer, et cetera, where there's an online version to go to receive support and services. One of the counties that we're partnering with within the Southeast region had magnets made and put on school lockers for students. So we'll continue to move forward with that as well. So this is a great opportunity for us to partner with our Southeast region coordinators, and that's been supported by a grant that we have been getting annually. And this year we decided to merge our funds towards this initiative for the greater good of all the communities. Fargo-Cass Public Health has partnered with NAMI, North Dakota, and so the National Association for Mental Illness is now hosting a support group for family members of a member who has mental illness. We are hosting that group at Fargo Cass Public Health the last Thursday of the month. And there's a flyer there, and we can get those out to people if anybody else would like to share that. We've also been looking at internships to be hosted at Fargo Cass Public Health. Within those applications, we've had 2 that have come through for health information management, which isn't a internship that has, it's a typical internship. So we've been hosting one last summer and one just finished, and it's an NDSU student who's doing a communications-focused service learning project. So we are happy to be hosting them. The project, this one is specific to providing credible immunizations, education, and awareness to a variety of audiences for the current NDSU student. We also referred an internship application who came forward to us at Public Health, but because of the specialty that was really looking at the application, I felt it best for that person to be partnered with Dr. Nagpal because of the prevention and infection control that they were really dialing into and their history looked at, and forwarded that to Dr. Nagpal. He agreed, and they're working to have that intern applied then to Sanford instead. So really nice to work across with you to be able to accommodate that student. We will also be hosting an intern starting April through June who will be assisting us with the community health assessment and the community health improvement plan. So looking forward to having some intern assistant in that. Our winter warming has occurred at Fargo Public Health in the building where the old police station has been. That will be wrapping up April 30th. And we are starting Public Health Week next week, Monday. With that, Larry Annenson and Maddie Vertis will be presenting on a panel at NDSU during their public health campaign, week of festivities. Our environmental health and nursing divisions will be presenting at Horace Career Fair during their public health week as well. We hosted a tobacco action, a youth action summit at the Avalon, which was successful on March 4th, and we had roughly 100 participating students attend that, and that was done by our health promotions team. And I just want to give a shout out to our staff and divisions who are working on numerous software implementations. Our environmental health program has gone through many hours of converting to a new Tyler software. Our finance team is also transitioning to a Tyler software, and emergency preparedness has been working weekends and many hours on the conversion for emergency notification systems to be in place, as well as measles tabletop exercises across the state. And grant applications are also going in. 2 of them were submitted today for public health block grants on expansion and cultivating wellness. We applied for a Sanford Community Grant and also the Justice Community on Opioid Interventions grant also were submitted this week.
Okay, does that conclude that for the moment? Jen, does anybody have any questions on any of these topics or feedback? I'm just curious, generally speaking, what's the sense of status of federal grants and monies coming from the government? I just don't know. Where are we sitting and what risks are we facing? Are things okay?
There have been some realized cuts already, and we'll address that within our budget presentation, if that's okay.
Perfect. And lastly, I think it's important to commend all of your team. We did not have a single death, to my knowledge, this year of a person who's unhoused out there in the severe weather and the conditions they faced. And that's just an accomplishment beyond measure. To have that type of focus on at-risk, marginalized, struggling people, and to provide them security and safety and warmth and protection and housing and all of that. So I just want to say that it'd be a whole different story if we had deaths and so on out in the community. And it's worth noting that we haven't. And every year we go forward with that accomplishment, it's just beyond significant. So, okay, any other questions or feedback on these announcements? Anybody at all? Okay. Absolutely.
I
Jamie?
just had a little question on the bike rodeo. Is there an age range or anything like that?
I don't think that we have an age range. We would prefer them to be able to pedal, and there are other scooters that they can put their feet on and go through. So I think roughly up to middle school is where we're looking at. And so there's going to be a course that will be set up, and they will have different stations that will go through again for the helmet fitting, the bike fitting, and just fun safety.
Thank you.
It reminds me up at home where my family's from, they put their little kids in this gym in Park River, and they ride sheep through the building, and I'm going, oh my God. No kids have gotten killed there that I know of, but any other feedback or questions? All right. Now, we'll go on to introducing our health officer, Dr. Lindeman, and I'll turn that over to you, Jen.
Thank you. The health officer position for Fargo-Cass Public Health was posted on February 3rd, 2025. The application process was open until February 26th at the end of the day, and the interview at Fargo-Cass Public Health was completed on March 26th. We are pleased today to be able to announce that Dr. Jessie Lindeman is becoming the health officer. She's still working under the interim contract, but will become the health officer of Fargo-Cass Public Health. The appointment did go through commission as of March 31st and is here today as health officer. We will continue to work on the contracting, and that will come through commission in the next commission meeting.
Dr. Lindeman, let's give you a couple moments to share with us your thoughts.
Well, I'm Jessie Lindeman. I'm a family medicine physician. I grew up in Fargo. I started my career as a chemist. I have a master's degree in organic chemistry. I changed careers in my mid-30s into medicine. I went to UND, and then I went to UW, it was the UW Eau Claire for my family medicine residency, and then came back to Fargo. Worked at Sanford for many years, worked at Community Health Service, Inc. in Moorhead for a couple years as their medical director, and now currently own my own independent practice called Willow Health in South Fargo. And since I'm my only employee there, get to serve on this, serve as public health officer and put my time into this as well. And I'm very excited and happy to be able to serve the community. So thank you.
Dr. Lindeman, what would be your message to all the rest of us of how we can have the best year possible going forward?
In terms of your health?
No, in terms of the Board of Health and Public Health and the services we all participate in.
Oh my gosh. I guess just keep going, keep doing as much as you can, keep coming up with new ideas and figuring out ways to best serve our community together.
Thank you. We look forward to your leadership. Does anybody have any questions? The good thing is everybody already knows you. My sense is you have working relationships with a lot of people, and it's entirely positively founded. So that's going to be you're going to hit the ground running. All right. Any questions or feedback for Dr. Lindeman in this position? All right. At this point, we'll turn it over to Jen and Melissa to address topics with regards to the preliminary budget.
Thank you. With the budget and some of the media that you may have heard already from our city commission is that there will not be new positions to the general fund again for 2026. It feels really early to start talking about this for 2026, like we've just been here to talk about the budget, but for 2026, there'll be no new positions to the general fund and no new operational expenses to the general fund. And we will go through the numbers shortly, but to look at some realized revenue from our 2024 to our 2025 budget that you might not see as the nuanced in the budget numbers when we show them is our environmental health program added a service fee, a flat base rate fee for the drive-outs and the paperwork processing last year. And so that was already added into our 2025 budget, moving into 2026. And that was $110,000 that was realized by them adding that $100 flat rate fee. And that is consistent with other communities. And it is actually somewhat less than some of the other communities charge for that service and that base rate. Our nursing services also changed a CPT code that had been utilized for home visits, and that was an additional revenue source for those 5 months of $110,000, but moving into the budget for a full year's time, we would see potentially a revenue of $300,000 from the offset of that new budgeting code, CPT code. We have a consistent budget moving forward roughly from 2024 to 2025 and now into 2026. And that is being realized even with a 4.5% COLA that was given in 2025. So maintaining costs and operational fees will be significant for Fargo-Cass Public Health to be able to keep tight with the budget and responsive to the community and taxpayers. In January, Fargo-Cass Public Health began a cross-divisional training, and that was to reduce overtime in other areas where there has been short staffing. And with the cross-training, our divisions have been able to help out in other areas and, again, save finances and overtime fees. So it's been super helpful, super supportive, and I've very much appreciated the staff being able to do so and to accommodate that. Many of our salaried staff are doing that. It does not afford them overtime, but they are able to move over into other areas, and it's helpful. The Fargo Clinic and the nursing divisions met with Blue Cross Blue Shield, the Executive Director of Government Programs and Health Integration, and that was to examine CPT codes that are currently being utilized within the clinic and within the nursing division. The CPT codes are just ways in which, for those that are non-medical, are ways in which we can bill insurance providers for reimbursement for services provided. And it's a significant book that basically coders go to school to learn how to use and can actually do well at. We realized there were some opportunities to further explore that we could bill for insurance reimbursement, and we'll continue to explore that. We'll have another meeting with this department and work with harm reduction in our withdrawal management unit to explore some of the opportunities there as well. So wanting to make sure that we are offsetting any of the general fund expenses and helping us to be a little bit more financially responsive to the overall budget that we are going to be presenting. We have discussed also having an insurance navigator located at Fargo-Cass Public Health. This is a position or a person who used to be there weekly and has come down to now monthly. Internal dialogue has been a little bit about the offsetting of the people who are presenting to Fargo-Cass Public Health being underinsured or having no insurance being almost 50%. So if we could have somebody who would assist in insurance navigation, medical assistance, completion, or whatever marketplace add-on they might be able to qualify for, we could increase not only reimbursements to Fargo-Cass Public Health, but also to set them up to have success to be able to get medications elsewhere in the community or even to our other health partners to be able to support that. We would look to have that increase at Fargo-Cass Public Health, and we'll look at a couple of ways in which to do that, if that is a position or a role that we could have supported by a current staff member, or if we could get additional support for that from our family healthcare clinic or Cass County. So that's going to be an ongoing effort that we realized the need for even more this week. We do have health and human service funding changes, to your point earlier, Chairman Strand. And with that, we have funding changes that have happened. We've had some grants that have been impacted, and I had some bullets for that, but some of the funding changes that we had immediately impacted was the immunization boosting grant, and that was roughly $104,000 that was stopped immediately. And there was an article in, I'm forgetting the paper that it was in, but there was an article that the rollout of this information came to the state, and the nuance to that was everybody has a federal officer at the state side for grants that they're managing. And one particular person at the state side noticed that a color was different on their memo in their notes from the grant, from the federal agent. And this made them pop it open to look at, and the federal person sent a memo through the grant folder that they had stopped their funding effective immediately. And so the rollout to the state has been, to the states has been not really comprehensive, and we're learning as we go what funds are at risk and the things that we are losing. So we found out about funding stoppages that happened 2 days previously, and that were effective immediately. So we are assessing those things as they come, but one of them was the, again, the immunization boosting grant. They're on the screen now, sorry. The Epi and Lab capacity, COVID-19 health disparities grant dollars were taken back. The community health workers COVID response and resilience monies were taken back. The mental health block grants, and substance use and prevention treatment and recovery services. So the immediate impacts of that to us at Fargo Cass Public Health included the immunization grant for boosting immunizations, and some of the, is there the next slide? A 10% reduction in our state opioid response grant, and that was $29,000. We did lose the Southeast Regional Block Grant, that which I talked about, the Credible Mind platform that we just created. That now becomes a competitive grant in the state. So it was guaranteed funding before, and now it will be a competitive block grant. And then there's one more bullet on that, and that I've already discussed. And so with the loss of some of this grant, we did have workforce dollar grants that can cover these expenses at the current time and the infrastructure for what Fargo Cass Public Health is doing, so it's not going to be lost. The work effort that has been created and is out there currently will not be lost. We'll continue to be able to provide the services.
Does
Questions
anybody?
on that part so far?
Does that conclude it, Jen?
Pardon?
Does that conclude this part of your presentation?
I believe that it does, and then we'll go into numbers.
Okay. Let's do that right now. Is that Melissa?
Yes.
Okay.
So the sheets, the first sheets you have in your packet, not up on the screen, I don't think. Yeah, no. The first sheets you have in your packets are our regular monthly budgets, so you can look through them. This is through February. I'll just make 2 quick comments on that, that basically they're exactly where we were at this time last year. We had a couple of things this year that were one-time purchases, so there are some numbers and the expenses are slightly higher than they were last year at this time, but that should level out. And then in the revenue side, I bill January and February of all of our grants, get billed in March the way we do month end. So none of that revenue shows up here, but it is all in the coffers as of today. So I'm going to go on to the expense budget for 2026 and just give you a quick note that we have at about 60 programs at Fargo Cass Public Health, which is under 10 different divisions. So just a side note there. I'm going to go through some of these line items on the expense side. So the ones that I've highlighted for you, our interpreter line, we've seen a continual increase in the use of interpreters. We use the language line and we use in-person interpreters. That continues to increase, so we are increasing that line. Our health officer is paying, we're covering 4 hours a week plus a portion of the malpractice, and we're paying a separate amount per hour for any media and education that she'll be doing. Jump down to computer services, marketing, and contract services. The computer services was a line item we had in our Cass County Jail. We had providers there that had to have e-prescribing services, and that was costing money every month. So Cass County Jail is now all under Cass County, so came out of our budget. The marketing and contract services were one-time grants that are now done, so we removed that for next year. Jump down to mileage. We have a lot, 20, 30 staff that drive their own personal cars for home visits and environmental inspections. We have some city cars, but the majority drive their own, and so we increased based on the mileage reimbursement rate that went up again this year. Our next line item is called guest, bus, or hotel. So we had a line item in our budget the last couple of years for bus passes, hotels for some of the harm reduction clients. That was getting paid for out of their donations. And we decided with conversations with the finance team to move that out of our budget. It's now in its own fund. It's out of general fund, and so that's getting handled separately. So we took those out, and then the next thing that happened is we have a grant, North Dakota Homeless Grant, that will pay for shelter overflow for hotels. So now I'm adding it back in. So that's how that works. Down to the next group of all the supplies, general, medical, pharmacy, which is our vaccines and our meds in the clinic, lab supplies and general supplies. Mostly, we are just doing a reallocation to move things to the right area. Lab supplies is really the only thing that's increasing, but not a huge hit. And then the last couple lines there on our budget, we are, capital requests for next year is in a separate spreadsheet. The city handles that a little bit differently. So it will, I think, show back up in here. They're changing how they do it. So I'm taking it out because that's what they told us to do. But I think in the end, it'll come back in for next year. Our capital purchases are only for things like washers, dryers, colposcope, an exam table, those kind of things. Right now, we have it slated for about 15,000. Haven't settled on those numbers yet. Our budget is due to the finance team next, or the 14th, I think it has to be sent in to them. We will meet with preliminary finance team and our commissioner in May and then again in June. So we should have firmer numbers by the time we see you again in July. So I'm gonna hit the next page, which is our revenue numbers, and go through some of those. And then one last page, and then any questions you have. So our grants, the very first section there is the federal grant that we get that flows through the state. So the first grouping, Women's Way, all the way down to emergency preparedness, those numbers have just been adjusted based on our current contracts. As of yet, we haven't heard anything from the state on any of these, so moving ahead with those. The next line, Regional Health Network, that is what Jen was just talking about. That funding has ended, but it's been recategorized, and we have applied for the new money. The MCH breastfeeding obesity, that stayed the same. The next group of 5, family planning telehealth down to the FEP workforce, is all money that came to us mostly from COVID, and that was all one-time funding and all ended in 2024. The next grant line item is public health workforce, and as you can see, in 2024, we actually received 198,000. So that number will be adjusted, but we won't adjust it till the end of the year. It is all grant funding, everything that goes through that, so we'll see how that one turns out in the end. Jen talked about the boosting immunization grant that technically was supposed to end in May. It is now ended. The boosting school immunizations, though, is continuing till the end of June, and we'll spend that out. The next group is our state grants. So again, Jen has already talked about the 10% reduction in the SOR grant, and then withdrawal management. We had funding currently. We're waiting to hear if that will continue into next year. That we don't know. State aid is not changed as far as I know. The state has requested 10 million to go to all local public health. We are currently at 8 million to all public health, so if that goes through legislature, then that funding will go up. The 2 that are highlighted under here, did you have a question?
Just to say, if that does go to $10 million, the math on that, it would change for Fargo Cass Public Health to be an additional $500,000.
Okay. The next section, the local funding that we receive, we are working on our contracts with the county schools where we have nurses, and Fargo Public Schools are doing an RFP, and we're waiting to hear on that before we proceed, so those numbers haven't changed. And then I'm going to jump down to insurance/Medicaid. Jen talked about some coding changes. We expect that to be higher going forward. The neighborhood, I'm going to go down to miscellaneous. Neighborhood response, that was a trial program we've been running downtown Fargo with our harm reduction team that is currently funded by the planning department. Don't know if we're going to get that funding next year, so I took it out for now. And our Cass County contract, the next grouping there, we're still working on those numbers. Don't have that finalized yet, but it will be a minimum of 1.2 requests to the county. And then environmental, those numbers are just based on history. So expenses down a little, revenue up a little, but pretty much even. The next page is going to show you kind of how our funding sources end up. So shows you our actual for 2024, our budget for 2025, and our projection for 2026. What I'd like to point out is we projected 2024 general fund for the city of Fargo to be at 45%. We ended at 39%. Of course, with everything being in flux right now, I can't guarantee that same outcome this year, but we'll try. And the other note on the bottom, the last line is self-pay / fee-for-service. And the difference in that actually going down is because of the Cass County Jail. We had a contract to do those services. That was over 500,000, so that came out of that number. And that is our budget. Do you have any questions?
Anybody have any feedback or questions? Dr. Nagpal?
So when you were negotiating with BCBS about billing for CPT codes, have there been any discussion with other insurers like Sanford Health Plan? That's number one. And the extension of the same question, are you able to bill CMS or is that called double dipping?
Go ahead.
We haven't yet talked with Sanford Health Plan. We did talk with the person from, Blue Cross Blue Shield, who had knowledge about the Medicaid and Medicaid expansion pieces. So that was one of our angles. We will end up talking with Medicaid, especially Krista Fleming, potentially from the state side for medical assistance, having yet spoke with Sanford Health Plan. We talked about the contracts that came through for like our TRICARE, for example. Some of the contracts that we have do not even cover the cost of the immunization being given. So some of those are not able to be moved at all with what we are able to be reimbursed. But we're examining more of them. We just started this week going through that level.
Thank you.
But thank you for that.
Any other feedback or questions? Anybody?
I would like to say to any of the new members, if you would like details, any of the members actually, I'm available if you would like to get to the nitty-gritty of some of the numbers behind everything.
In preparation for this budget, also, I met with each of the division directors to speak of the dollars or the things that they needed within the division. Commissioner Strand did join for those meetings. Each director and Commissioner Strand and Melissa and I visited about the budget so that we were all aware of the asks and needs and if there was anything that could be given back and not needed this year. So that was something that was new, I think, and appreciated. So Commissioner Strand learned a couple of new things about our divisions, and it was good to have his presence.
Any other budget issues? A question I have, Melissa, might be, and I don't want to be belaboring this, but we have 1.6 million in temporary and seasonal work. Help me see the balcony view of that. How much of that is harm reduction and downtown engagement center and that work, or where does that all land? And then I'll follow up.
Most of our temporary seasonal budget line item is in the harm reduction program. We have a few other divisions that do have division or to have temp seasonal work or temporary staff. That is an area we have requested the last few years to start moving. Those positions have been here, they're not going away. We have requested the last few years to make some of those positions full-time staff. The benefits are exactly the same, it does not change, it's just not a position that's listed in the City of Fargo budget. So it is a request, and
16 people?
it's at least 16 people, it's probably more than that.
16, did you say?
In harm reduction, it's at least 16.
16.
So we manage, it's actually, in the temp seasonal budget, it's not by position, it's by dollars. So they manage that differently, whereas the rest of our budget, we are all a peg in that cog. This is a total dollar amount. So they can hire as many as they need to within those dollars. So
Great.
the number of bodies can change.
Thank you for clarifying that. And way up in the balcony, there's this desire to not grow our FTEs, our full-time employees. Yet that's a percentage of our, what is it, 7 million for our overall employees and 1.6 million for temporary and seasonal. My personal desire is to see us shift as many of those people over to full-time employment equivalencies as possible. It's a wash in a sense of that, but it also addresses their security, their sense of stability, their sense of being appreciated, their sense of being long-term, their sense of being part of our system. And I know the mayor's in the back room and he's in charge of the budget. So I'm going to let him hear me say this. I'll go out on the limb, but that's a desire I hope we can accomplish. It's also respect the people in that department. that are delivering those services that I alluded to earlier. We didn't have one death this year out in the elements. So anyway, bear with me, but that's my personal bent on
Thank
that.
you for that, Chairman Strand. Some of the people in that pool of staffing have been here for 9 years doing great work. And it's not temp seasonal when it's 9 years and it's confirmed they show up every day. I would like to use the words PRN staff if we need to have temporary staff, and that's kind of the team, the words in the health field anyway, when you have PRN and those are temporary employees, and you can have those people not count against you if they're not being utilized. But I think as we look forward as really tidying up the budget and reporting back to commission on overtime utilization, it's nice to have everybody accounted for in a position that they're occupying and that we can track the hours that are on their schedule, and we can do our, just really their position control and on that. So we agree on the wanting to move those into positions, and then we'll talk through that with our finance and human resources teams.
And my sense is the more we as board members can keep a focus on that, whether in our minds it's a priority or not, so we can advocate appropriately or not for that transition. You know, but I just think it's a front burner topic, and I'm glad, and thank you all for bearing with me on that. Any other budget questions? Mayor Dardis?
Just about got promoted there, Doctor.
Well, yeah,
All the doctors in the room.
we could switch seats here quickly still.
That ought to make you shiver. On your statement of revenues for February 2025, you have a lot of zeros beginning. And did I hear correctly that that's not unusual, that this is, being it's in the first quarter, this money doesn't normally come in?
Right, based on how we do the request for reimbursements, I'll send January and February and March. What gets submitted in January is actually all of 2020, is the remaining of 2024. That kind of happens again in February. So it's a time lag there, but that's how we keep everything separate.
For all the different areas that your staff work in, and for the dynamic that's going on right now with regard to grants and the like, do you feel that, are there anything here that programs that might be targeted or eliminated because of this, and that we need to act now?
I think, generally speaking, we will address those as they occur. We right now are lucky enough to have a workforce grant that could help us limp things along if we need to. I don't see that going away. Of course, anything can happen, so.
All right, thank you.
And Mayor Dardis, you know, one of the benefits I think we have right now is we have a real powerfully influential congressional delegation that will fight for us. So the message I've heard is, if you see things coming your way, let us know what's in the balance. Let us know what's being challenged. Like Senator Hoeven's chairman of the Appropriation Committee. You know, so that's just we're really fortunate that we have that connection. But let's keep those channels of communications open so they know what we're facing and hearing and needing as early as we can possibly share that.
We are participating in surveys and communication with our state agencies on city community health organizations. And there was a survey put out this past week on what are the cuts that are being experienced within the various health units and what is the impact of those cuts. That way we could roll that up together as a state for the 28 local public health units and then roll that forward to NACCHO, who's taking that message to Congress on the Hill for us. But really looking at what are our service cuts, what are our hours cuts, what are our program cuts, and the impact at the state level so we can have a bigger voice together.
And Jen and members of the board, even though we meet quarterly, we need to be available if things change quickly, to convene, to address the topics that are surfacing unexpectedly, so we can be on top of that entire issue. Okay, any other questions? Grant? I'm sorry, Jamie?
Yeah, it's just a few questions. You'd mentioned with the state budget for public health, the potential of $500,000. Just for clarification, that's over the biennium or annually?
And that would, I guess, I don't know, annually? I don't know. Honestly, I don't know the answer. I don't know if the 10 million, the 8 million, I think is, I don't want to say the wrong
Okay,
answer.
that's, has an impact.
It's a
So
great-
This is how we learn.
Divide
Thank
by
you.
two.
It's a great question. and
it is
it's
a good
normally
question.
Biennial.
Yeah, so that's something I just wanted to get clarification on. I also noticed in the budget, you mentioned the decrease in the state opioid response funds, but I do see a slight projected increase in the opioid settlement funds. Can you
So
describe the different programs involved with that and how those impacts, if there's any offset or if it's completely unrelated to each other?
they kind of work hand in hand, but the opioid settlement dollars, actually, we already have most of that in the city. This is actually just what we're spending and moving the funds over as they're spending the money. So we're kind of keeping close tabs on it to watch the fund that we have and how long that might last us based on our current use. But it is the harm reduction programs that quite a few of our staff work in.
In addition, the SOR is a grant, and the state opioid dollars are those dollars that are coming through lawsuits that are then sent out to cities and states.
Yep,
So,
thank you. I still have a few more, if that's okay. I wanted to echo kind of the question that Mayor Dardis had regarding trying to submit grant funding requests as expeditiously as possible for any, seems like the funding is being cut off rather abruptly, so.
It has been cut off abruptly, but they have given us, even in the boosting grant, we have until Monday to submit our final request. So that is, at least they're accommodating in that respect. But the other thing is quarterly, everything is submitted at least, the end of March here, April 15th will be, everything from January to March will be submitted. So it's just this kind of odd timeline we have right now for January and February, but it is across the board. That's pretty normal.
Okay. I wanted to make a brief statement in regards to the challenges with, or the uncertainty right now, I guess I would say, with the federal funding is just, and looking at the preliminary budget, I realize there could still be changes. I hope the local subdivisions that the hold the line steady budget, I hope that's a floor and not a ceiling. As saying that as a health professional and an advocate for public health, this is a difficult time and we need to support our people locally. And finally, after that, I do have one last question related to all of the budget that's been discussed. How's morale?
Good question.
You want me to answer that?
we have some HR folks in the room. I think it's good. I could be naive to this, but we put in 3 grants this week, and we were excited. There was a cross-divisional, 2 grants cross-divisionally that went in with environmental health, the clinic, nursing, and WIC. And all of those people participated on 2 different grants, and kind of the excitement for the opportunity to get the grant and to be able to do the things that we're proposing in the grant was fun. And grant writing isn't always necessarily fun, but to actually envision doing the work that you could get to do if you got the dollars would be wonderful. Also, Taylor from our withdrawal management unit put forth a grant, and Jan Eliason assisted in that as well. And so looking to get dollars and supports to do that work. So anywhere there's an opportunity to tap resources perhaps that we've not tapped before, we're looking. Dr. Lindemann actually forwarded a grant application opportunity for us for screenings and preventative care. So just we're looking, and so I think we're putting forward more grants than 3 this week is great for us, but I think that we're working well.
I'm glad to hear that, and I hope staff realizes how much appreciation everyone has for their efforts.
I'm going to go to Mayor Dardis next, but Jamie, let's bear with me while I tag on that. To the staff and leadership at Public Health, you're already hearing from the board that morale is an issue and a concern. And please know that's a high priority. Jen, you're brand new to your job and you're inheriting a lot. But from this moment ongoingly, please let us know how we can shore up any issues relative to morale, so you have the people that are as love their jobs as much as possible and are happy in their workplace. So that's a really important question, and it's important for all of us to constantly be aware of relative to our work. What do you have? 180 some people? How many people in the department? 150. It's bigger than my hometown almost. So thank you for that. Mayor Dardis, you had a
question I have is, do each of your departments work separately on these grant writings, or do you have a designated employee that's a grant writer?
If the grant is in one division, then that division would work towards that grant. When there's an opportunity for us to work cross-divisionally and be supported in the same grant, then we join forces and meet together. We do not have a designated grant writer within the organization.
I know in our jurisdictions type things that we're dealing with, that's one of the things that the League of Cities is always talking about, is to invest in grant writers, professionals that know how to search for it and how to the nomenclature that is required in order to be successful. So
yeah, we did enroll this last fall in the the grants.gov for the first time. So multiple of us have logins for that and can have notifications for search words that we put in that we're interested in. So we get notifications when there's opportunities that fit the description of the work that we do.
Okay, thank you.
And Mayor Dardis, so we all know, is Southeast Regional Director on the North Dakota League of Cities Board. So we have a direct bridge there to that entity and a voice there, and that goes both ways. So thank you for that as well. All right, any other questions on budget? Next topic on our agenda is the Community Health Assessment. I'll turn that over to you, Jen, is it?
I'll just add one last thing on the budget.
Okay.
You will see that back again in our July 11th meeting before it's finalized through City Commission, and we hope to be able to give you some more of the numbers and feedback what we're getting from the state side by that point.
And if we see any real surprises, let's convene earlier. If there's anything we need to address, because July is getting to the point where it's unfolding and almost etched in stone. So if it be available to, or be open to bringing us together to help shore up any issues and needs as a board would do. Okay?
Thank you. I will.
All right, now we'll go on to Community Health Assessment.
Yeah, so for this, we look to have this completed between April and June of this year. We're in April, so you'll be getting a doodle poll and some invitation opportunities to participate in that. Currently, we have board members Severson and Steg participating in the Community Health Assessment and Improvement Plan. If there's anybody else on the board, now that the board is full, who would be interested in participating in the development of that, using the survey information that has been reviewed earlier, we would welcome you in that participation. You can either let me know, or you can let me know now, or email me after the meeting. We will be working with an intern who will be joining us also in April. Maggie Riddell is getting her Master's of Public Health. She's a candidate now and has over 10 years of experience working with the Centers for Medicaid and Medicare Services as a Medicare administrative contractor. She was working with Noridian previously. In September, she had earned her Bachelor's of Science in Health and Wellness from Rasmussen and immediately went on for her MPH. So she will be somebody in policy and in work to help us facilitate that, and this will be her project towards the end of her time with us in June. We will have that back to the board in July 11th as well to review our Community Health Assessment and Improvement Plan.
Any feedback or questions at all? Jamie and Dr. Severson, thank you very much for volunteering to be at that table when this unfolds. Anything else on that? Okay, we'll go on to our next topic, which is strategic planning, and I'll pass it over to Jen.
I was asked to pause on the strategic planning, so we had a full board to participate in the opportunity in the development of the strategic plan. As the board is aware, our strategic plan was finished in December of 2024, and so we are looking forward to having a new strategic plan and the development. We are looking at facilitators for this process. I talked about the previous facilitators, and we decided to not utilize the previous facilitators for the strategic planning. There were multiple of us in video that was shared with directors on one of the platforms that we're looking at for facilitation of the strategic plan, so hoping that this can work out. We would like to begin our strategic planning with our stakeholders in September with a plan for completion of our strategic plan by November. And I guess I would ask for, if there's any interest from the board members to participate in the strategic planning efforts beginning September, finishing in November, we would welcome that as well.
Dr. McLean was just raising his hand, I believe. Didn't everybody see that?
I did not.
Oh, I saw it clearly.
You know, Chairman Strand, I need to warn, because when Dr. McLean had interviewed and talked about this particular position, he was asking what other hours outside of board meetings he'd be required to do. And I said, that's completely up to you.
We've just added to it. All right.
We welcome any participation in your feedback and expertise.
How would we best make sure that that doesn't hit the wall and die? How do we continue this request so we do get some participants? Any thoughts?
If I don't have anybody before our July meeting, I can re-ask in July.
Great. And I'll be happy to help intercede if you need that as a board chair.
Thank you very much.
Okay. The more we have, the better. All right. Anything else on strategic plan? We'll continue to the legislative update, and I'll pass this to Jen as well.
Legislatively, FargoCast Public Health provided written or video testimony in the following bills. The House Bill 1570 and Senate Bill 2281 were both tobacco tax bills. Abby Lang and myself and Larry Anderson provided testimony on those. Those are both efforts to increase a tobacco tax. It is one of the proven ways in which tobacco utilization is decreased by increasing tax. And actually, if the tax is increased at a rate in which it is felt by the person purchasing the tobacco, it is even a bigger decrease in the utilization of tobacco. It also looked at taxing tobacco in ways by doses, so different strengths of the nicotine, if you will, were going to be taxed at different rates. So when House Bill 1570 had died earlier in legislation, and then we had moved over to Senate Bill 2281 as our last opportunity to receive a tobacco tax, with those dollars, as we know, then support a community health trust fund, and those dollars come back into public health. And the money that was from this tax was earmarked for public health and also mental health and the 211 system, or the 988 system, rather. Both bills were defeated in legislation. So there is no new tobacco tax. Last time that was increased was in 1997. House Bill 1541 and Senate Bill 2267 are on septic systems, which is also under the public health purview, and Grant Larson here as our director of the environmental health provided testimony along with Aaron Johnson and myself. These were both bills that took away most of the public health purview in septic systems in the area. FargoCast Public Health Environmental Health does the septic system inspections and regulation for the Southeast region, and again goes back out to those counties that are in the Southeast region I referenced earlier. And so we weighed into that, and Aaron is actually a staff member at FargoCast Public Health, but is also president of the board for North Dakota. And we had good following on the testimony. Both bills are now, I think, in the conference. They're going to be merging into a new bill. So waiting to hear more on that, and legislative updates happen this afternoon. House Bill 1012 is the North Dakota Department of Health and Human Services budget, and this was the public health state aid that I provided testimony on for support to state aid. SACHO, the State Agency for Community Health, City and County Health Organizations, maybe isn't even looking to get the full $10 million. They just don't want the $8 million to go away or be reduced either. So $10 million would have been wonderful, but we're hoping just to at least keep the $8 million. House Bill 1425 is a deflection, diversion, reentry bill, and this is something that would align with the deflection services that are being discussed for the new engagement center. and services that could be provided there. This was a conversation in a meeting that I provided support to in a conversation with Governor Armstrong and the mayor and the chief of police, who also traveled out there to have a discussion with Governor Armstrong on this particular matter. House Bill 1605, I asked the board for support on this for the fluoride in water ad, and you all responded timely. It was wonderful for us to be able to submit a joint effort on that. It did pass, so we have still fluoridation in water for public health. And then I participated in Public Health on the Hill Day, which SACHO was there, and I got to speak with a number of our representatives and senators for the public health needs that are continuing within the Fargo area. So that is what we participate every Friday afternoon on the Legislative League of Cities call, and then SACHO has a call that follows that, as well as the City of Fargo, so that we can be apprised of ongoing other matters that we need to either pledge support to. So if there's a desperate need from SACHO and they are calling out to the local public health units to weigh in on a bill, then we can get our support up to the testimony with SACHO.
Great, thank you, Jen. Any questions at all for Jen and team on regarding legislative topics at all? Okay. We'll go on to Dr. Lindeman and Jen and have an update on measles.
Thank you for the invitation to present today about measles. It's a very important topic, as we've been hearing in the news. It is back. It is probably going to be back in this area. It will be sometime, is the expectation. So this is meant to update you on what is measles, what to look for, and then I'm working with Brenton, where he's our epidemiologist. He's gonna talk about numbers and data. So just to kind of give you some background, what is measles? We haven't seen this in decades. Parents, the community, the public, and providers do not really know how to recognize it. They haven't seen it. So it is a highly contagious viral illness, and there is a recent rise in the United States. And I just threw in this fact: first measles vaccine was approved in 1963. We mostly eradicated it from the United States decades ago, and now it's back on the rise. So I was just going to talk about what you're looking for with measles, and you have an initial stage of an incubation period that lasts for about 13 days. People are asymptomatic during this phase. Then you have the prodrome period, lasts for 2 to 4 days. This is kind of a typical viral infection with fever, fatigue, loss of appetite, conjunctivitis, runny nose, cough. You can have this, what's called an enanthem or Koplik spots on the inside of the mouth, which are little white spots. They don't necessarily mean that you have measles, and not everyone with measles has them, but they always should raise a concern for measles when they're present. And then after that, you have the exanthem phase, or the rash. This is what a lot of people think of with measles. Happens about 2 to 4 days after the fever onset. You have this erythematous, which means red, maculopapular, blanching rash. Blanching means when you push your finger on it, it turns white when you lift your finger off, and then the color comes back within a few seconds. These red areas often coalesce, meaning they run together, and they become non-blanching in later stages. The rash begins on the face and spreads down the body, and usually the palms and soles are not affected. And then you have a recovery period. You can have a cough that lasts for a couple weeks, and then we think that immunity is lifelong. The period of contagiousness, we think, is about 5 days before the rash appears to about 4 days after it appears. What do we do when we suspect measles, and when should we suspect measles? We would suspect it in people who are unvaccinated, people who've recently traveled, especially to areas where we know there's measles. Febrile rash, especially if they've been exposed to measles. And then this picture here is an example of a sign that clinics may start to put up that asks people to stop, look at these symptoms, and not enter the clinic if they think they might have measles because of how contagious it is. And this is for the public to know too, that if you see these signs, or if you think you might have measles, please call the clinic before coming in and figure out how we can best take care of evaluating you. These patients should obviously be isolated, and then proper exam room cleaning techniques should be followed, and there's more information on that PDF link. Which is meant more for providers than for patients. And I think now I'll hand it over to Brenton.
Okay, so this is a little outdated now. So nationwide, we've had 607 cases. The CDC updates their data every Friday at noon, and that's based on data that was submitted to the CDC the previous Thursday. The vaccination status, as you can see, the measles or MMR vaccine is highly effective. As expected, 97% are unvaccinated or unknown. 1% had one dose and 2% have had 2 doses of the MMR vaccine. 14% have been hospitalized. There have been 2 deaths reported, one in a young child in Texas and another in an adult in New Mexico, which was the first measles death in the United States, or first measles deaths in the United States in some time. So we do know that it is a serious illness and can cause negative side effects. Next slide. So the outbreak states, as I said, this is updated. When I put the slide together, Texas had 422 cases, but now they have 481 cases. So the outbreak is not slowing down in Texas. Their information is updated on Tuesdays and Fridays. New Mexico now has 54 cases, also updated on Tuesdays and Fridays. Kansas is still at 24 cases. They update their information on Wednesdays. Oklahoma has 10 cases. They update on Tuesday and Fridays. 2 of the 10 cases in Oklahoma will not be reflected in the CDC data because they are probable cases. Some states count probable cases in their numbers. CDC is only counting confirmed cases. Those probable cases would be ones who don't have a laboratory confirmed test, but have illness or an exposure to someone with measles. And then Ohio has had 10 cases of measles as a result of a traveler or exposure to a traveler. If you look at the top 4 states, they all are a result of that Texas multi-state outbreak that has started up in the northwest corner. And then I believe the country of Mexico has had about 94, 95 cases associated with the outbreak as well. So this is a multinational now outbreak that has no signs of slowing down. And just so that you all know, United States has maintained its endemic status, meaning that measles is not spread within the community since early 2000s, and if the outbreak in Texas goes on longer than a year, we will lose that endemic status as indicated by the WHO. North Dakota data, we have not reported a case of measles since 2011. And then prior to that, we had 2 cases reported in 1987. So North Dakota does not report many measles cases, but we are always ready. Suspect cases of measles are whenever a provider thinks of measles, we work with our providers through our health alert networks, through immunization emails, and just through our field EPIs so that they can notify providers. But if they suspect a case of measles, they should call immediately so we can begin our investigations. And then immunization rate information can be found at the following links. We have immunization rates and school coverage rates, which the next slide is going to show a little bit, and I'm going to step over real quick so I can read it since my eyesight isn't that great. As you can see, the MMR rate for Cass County in 24-25 for kindergarten was about 92.85%, which is below that 95% we would like to see. It's not much different than it was in 21-22, but as you see in 22-23, we were so close to that herd immunity rate. We were at 94.59%. State level coverage rates, we are below the 90% at 89.98%. And then you can see our county exemption rates, which have been increasing down in the bottom corner. Cass County has had about a 2.51% personal belief exemption, which, as you can see from 21 to 22, that percent was 0.66. So we've almost seen a 2% increase in personal belief exemptions. And then you can see the same data for the state. And then the slide also shows the state immunization rates and where we have pockets. We would be most concerned if we were to have measles introduced in a community, especially out west, where many of our MMR rates are below that of what the area in which Texas has seen an outbreak. So those dark areas of the state are very low and would be very susceptible to a measles outbreak that would continue to be ongoing. If you are interested, for the public and board members, I just took a snip of the dashboard, but it will also break it down to individual schools. So if you're interested in what your school or what your community is, you can look at that information all on our immunization rate dashboard. And I think that's it.
Any questions?
I was just going to say, many of us of a certain
sorry.
age, had measles or thought we had measles. But I just recently, I'm going to be traveling abroad and being a healthcare provider. I'm pretty sure I had it, but I got a measles titer just to make sure, actually. But DHHS has a really nice algorithm sheet on at what ages, who should get immunized, et cetera. It's really worth looking at, particularly for people our age.
Dr. Engel?
So did I hear correctly that CDC is only reporting confirmed cases through a lab test, but not probable cases? But states are reporting probable cases as well. Is that true for all states, or it's a certain number of states?
Just depends on the state. Every state kind of reports out their information separately. If a case were to be reported in North Dakota, we would likely report probable and confirmed cases on a dashboard. We would put out a dashboard similar to what Texas, Oklahoma, and other states do, but especially with funding cuts and everything, what you see from every state is a little bit different. And some states, as I was navigating them, are super easy and fun to look at. Like Texas has very nice dashboards. You can see where the cases are by county, whereas then you go to another state and they have a news release saying they have 10 cases in the state. So varies on the state.
Yeah, that's concerning because as the outbreak snowballs, which it will, we are going to have a significant undercount of cases.
Yes, and that would be our concern, especially in our under-vaccinated communities. So we would just encourage individuals to get their MMR dose if they haven't, and check your titers if you are in that age group where it is a little bit goofy, where you may not know whether or not you were exposed or had measles as a child.
I have a couple of points as well. You can't get vaccinated if you're under 1. So any child under 1 could be exposed and infected with measles. 2, there are children that cannot get vaccinated because they're on medication to suppress their immune system, including many of my patients. And if they were to be infected with measles, it would likely kill them. 3, I've had patients stop their medication for their inflammatory condition because they want to get vaccinated against measles. So this is a real and scary thing. Lastly, vitamin A does not treat measles. There are children being admitted in Texas because of vitamin A toxicity. So while anyway, that's all I have to say.
And this is your field. I mean, you're not I know, but so okay. I have the dumbest question in the world. Who's at risk? Is it children or is it all? I just don't know. Who's the risk group?
The risk group is people who are unvaccinated.
Any age.
Any age.
Okay, my next dumb question. If you get infected, what do you do?
So no questions are dumb, but my answers are. So, as Dr. Severson already mentioned, it's a viral illness. There's no specific antiviral and there are no proven treatments. So you just manage conservatively, manage with fluids. Superimposed infections are treated with antibiotics. But unfortunately, we don't have a specific treatment for measles.
So bear with me then, the next thing to do is make sure nobody else gets exposed? If we can
Absolutely.
mitigate that and manage that?
Yep.
Okay. Anybody else with their question? Go ahead, Valentina.
Yes, thank you so much, Chairman. So my concern was in regards to the education pieces. You did mention providers have this flyer going up probably very soon. My concern was in regards to like the daycare settings and childcare. Are they receiving any form of education just to be alert? Thank you.
Good question. Yes, we do work with our childcare partners like Childcare Aware and the Department of Education, letting them know what the isolation and quarantine guidelines and what to look for. Unfortunate thing is if measles is introduced in a school system, anyone who's unvaccinated would have to isolate or quarantine who does not have disease for 21 days after the last case in the school or after the last time that they were exposed. So it would be quite a burden for those parents of kids who have unvaccinated individuals in a school system because they would have to be out of school for some time. So we want kids to be in school, so that's why we've been working with them to make sure that they raise their rates and they know what the consequences are.
Thank you so much.
Commissioner Capitan?
Well, I got kind of a dumb question and yet not so dumb. I've been told that I've had the measles. I've been told by my mother that I've had German measles. What's the difference? And I have no proof that I really actually had either one. So what do I do now?
You can get your titers done, and then you would find out what you're immune to. German measles is the mumps, right?
Rubella.
Rubella.
Okay, that I know I had. And on one side, and then when I was in college, I got it on the other side.
Really, who would have thought we'd be having this discussion in this era? Just who would have thought? Continue. Any other questions or feedback? Dr. Severson, did you? No? Okay. Raise my hand today. It's all right. Dr.
Just,
Neckball.
I just had a question for point of reference. You talked about the immunization rates in North Dakota, the area of Texas where the outbreak has occurred. Do you know what their rates are?
I believe when looking at their rates are about that 60 to 70-ish% range. So as you can see, Western and other pockets of our state are lower than
We have
what they were
places
in
in-
Texas.
Yep, thank you. And 95 is,
95% is what we consider herd immunity.
yep, thank you.
So just a couple points. If you were born before 1957, you're considered immune to measles because it's one of the most infectious diseases known to us. For every case of measles, you will have another 18 cases of measles. So the chances are that before the vaccine became available widespread, if you were born before 1957, you probably had, not probably, most likely had either symptomatic or asymptomatic infection. So people born before 1957 have been exposed to measles and are considered immune.
So I was born in 42. That makes me immune.
Yeah, yes, we would consider you immune.
Check your titer first. Anybody else? This is a really interesting discussion, and it's really relevant today. And thank goodness we have guidance and leadership locally, but please keep us apprised, especially if policies or actions need to be implemented from the board. All right?
Thank you.
All right, we'll go on to our next topic. Director update to Jen.
One quick second. We are at the time for our meeting roughly in 1 minute, but the room is already set up. We were told we were going to have a hard stop at 1:30 because there's another meeting coming into this room. Are you okay with going over to finish the director update?
Let's keep going.
Okay. I was asked by Board Member Severson to provide a response to the Board of Health regarding 2 articles that appeared in the Fargo Forum. The first article I was asked to respond to was the employee exits interviews point to a toxic work Workplace Culture at Fargo Cast Public Health. This was in the Fargo Forum in January. Since that article referred to data over a 3-year period of time, of which I was present for the last 5 months, I've asked Beth, who is our HR staff, and she was with the department during that period of time to discuss this particular article.
Good afternoon, board members. As Jen mentioned, I'm Beth Wigman. I'm the Assistant Director of Human Resources, and I'm here today to talk a little bit about exit interviews, what our process is with the information that we receive, and then how we respond to employee concerns when we receive them. So exit interviews really are a strategic tool that the city uses to collect feedback on employee experiences. And the good thing about exit interviews is it gives us an opportunity to receive that feedback from the unique experience that each employee who's exiting has, and provides us with an opportunity to understand what might prompt them to leave the organization. And so it helps us identify patterns in why the employees might be leaving, and then it provides us with actionable insights on what employees both appreciate about the organization, but also where we might have areas for improvement. Participation in exit interviews is always voluntary, and so employees are not required to participate when they exit the organization, and they can provide their responses as identified or unidentified. But now that I've covered a little bit about exit interviews and what they are and how we use them, let's take a look at the data collected from our exit interviews in that period from 2022 to 2025. One thing to keep in mind is that because the exits are optional for employees, these numbers represent the perspectives of only those who chose to participate in an exit, and is not a full representation of all employees exiting the organization in that period. But as you can see by the numbers in front of you, there are a variety of reasons that employees reported having left the Fargo Cast Public Health. And this data that you see represents that retirement is a natural driver of turnover, while family obligations and compensation and benefits have also impacted retention. Leadership and workplace culture have played a role in employee decisions to leave, as has the availability of career growth opportunities. And understanding these trends has helped guide our organization in creating opportunities for leadership development, compensation strategies, and other strategies that help us better support and retain employees. When people fill out the exit interview questionnaire, we do ask them to weigh in on a variety of workplace experiences on a scale of 1 to 10, with 1 being the lowest level of satisfaction and 10 being the highest. So the numbers that you see in front of you are an average of responses in that time period of 2022 to 2025. And so these ratings suggest that employees generally viewed benefits, job alignment, and work engagement favorably. Working conditions are positive, but career growth and supervision do show some room for improvement to help further boost satisfaction. So what do we do with this data when it's received? After the employee exits occurred, there's a structured process that involves 3 key groups within the city of Fargo, and the first of those being human resources. And so the exit interviews are always conducted with an HR manager, who then will review the information obtained and look to identify trends, areas of opportunity, and just feedback that they can share with departmental leaders. From there, they will work with those departmental or divisional leaders to implement strategies to improve the workplace where necessary or enhance organizational effectiveness. These strategies do vary based on the information identified in the exit interview. But from this feedback, just some examples of things that have been implemented. We did implement some pay adjustments and differentials where market data and indicated a lag in pay, or if there were significant recruitment or retention challenges. We've citywide made some changes to our benefits offerings, and then we've provided some additional leadership development opportunities. Depending on the situation at hand, we may also engage with the department leadership on facilitated conversations, conflict resolution processes, or corrective action. And when applicable, we will engage city administration if there is the need to do so and would propose plans of action at that time. But just as it's important to learn from our departing employees, it's equally important to understand the concerns of our current employees when they are shared with us. And so again, we do have a structured approach to following up on employee concerns when they are raised. And the very first thing that we encourage is that direct discussion between the employee and their supervisor, with the idea that the supervisor generally is the person that can best affect change in the area of concern. However, that's not always the case. And if the concern cannot be discussed with that direct supervisor, or the concern has gone unresolved, then HR will engage with that next level of leadership, whether that be the supervisor's manager or the department head. And together they will review the concern and assess its impact to determine possible solutions. At that point, actionable strategies would be developed to address the concern and help improve workplace conditions if needed. And like with exits, there are a variety of strategies that might be developed, really dependent on the situation at hand. But the goal is always to work toward a solution that benefits, all parties involved, but also the city of Fargo as the employer, and just keeping in mind consistency in approaches, policies that may be at play, and then, of course, overall employee satisfaction. And again, like with exit interviews, when necessary, we would engage city administration if that situation would require higher level attention. But that does conclude my portion of the discussion on exit interviews and employee follow-up. These practices are essential in maintaining a positive workplace culture and ensuring continuous improvement within the organization. Thank you for your time, and I'll hand it back to Jen.
The second article that I was asked to respond to was the Fargo Citizen-Led Advisory Group that the city is silencing their voices. This one was in the paper, I didn't write the date down, recently, sorry. By highlighting the points made from the article to reference here for the board's awareness and for the community. I'm looking at several of the points from the article, one of them being that there was a message that, quote, they can't eliminate the Board of Health, but the change that happened under the new leadership effectively did that by significantly decreasing the board's advisory input. To acknowledge this, there was a discrepancy between what was posted on the FargoCast Public Health website and what was on file on City Hall records. Regarding the terms that were expiring for the former board members. Upon notification of that discrepancy, a thorough review of all of the records was completed within our office and within City Hall. And it was confirmed that the term expiration date from all of the legal records was of 12/31/2024 for Evelyn Telford, Kayla, Chelsea, and Amal Day. When that was realized, the Assistant City Administrator, Brenda Derrig, reached out to each of the members affected to let them know and to invite them to stay on the board until the new board members were found. The board members at that time opted not to extend their time and termed as of 12/31/2024. I just hope that this board knows that the leadership at FargoCast Public Health has not had a conversation and does not have an intention to eliminate this board. Ever since I've started, actually quite on the contrary, in this position, I've asked for a way in which we can work together in a work format kind of like this room is set up now, or in other ways in or outside of this meeting, so that I could tap your expertise. You're on the boards as representatives from very select groups of people who can help us do better for our community. And so tapping that through our community health assessment, our strategic plan, other conversations, legislative supports, whatever that looks like. I have asked for that from this board since I've started. It's not always gone real smoothly, but it is something that I very much appreciate of this board, and I know that my staff does as well. Another point that was made was that the Board of Health was not consulted before members of Fargo City Commission cut 3.2 positions and requested special meeting of the Board of Health to discuss the cuts publicly and learned how they would impact the community. It is understood that the Board of Health reviews the budget much like we did today, and we will again on July 11th prior to its submission for commission, review and approval. And that you give the opportunity to review, advise, support, recommend, and give us guidance on that. To recall that the cuts that were made were effectively a reduction of 1 FTE who was occupying a position, as the other 2.2 positions had been vacated for an extended period of time and were still on the books and were just removed. This was discussed at length in the special Board of Health meeting held in October, and I won't revisit that here now in essence of time. There wasn't a precedent set for me as a new director coming into this position for me to need to come back to a Board of Health to discuss the cuts or the reduction of the budget. It had not occurred historically with this board when positions were increased or released from employment or received new position titles or salaries. In review of previous board meetings via the videos that I've watched in comparison to the budgets that were presented, that hadn't been done. And so the process that has taken place historically is that they go through leadership, human resources, and then city commission. So I did not have a precedent set in order to do that. And if that was a misstep perceived here, it is noted for if there is a reduction in force ever to come again. In your packets, you received the current services for Fargo Cass Public Health. I would like to share with the Board of Health and the community that Fargo Cass Public Health is expanding our services, not losing services as a result of last year's budget cuts. An example of expansions of the services include Larry Annison, our clinic director, reaching out to Lake Region Health Unit, who lost their Title X program. The clinic will work to support the area via telehealth. And Larry's reached out to the community medical services also to support their clients that can access services at Fargo Cass or us there. The nursing division has reached out to the community to do foot care clinics. It's a very needed service, and we will continue to explore opportunities to grow that. We've continued to we'll work with Blue Cross and other insurance to expand our CPT codes and utilizations and funding avenues to deliver more services and have some financial vitality in that regard. We are also looking to have, I'm sorry, I was not following the order of the slide as I looked up. A Wellness on Wheels. We have approval to purchase a mobile medical unit so that when we do outreach to our county members and towns, we have a confidential space in which to do some of that work where we can do outreach. And when we go there, we don't always have a confidential space to do so. So having a mobile health unit allows somebody to come into that space where we can work with our Women's Way and our immunization clinics, our clinic, and do outreach. And so just to know that we will continue to expand and to do the services we can as best we can with the potential budget cuts that may be coming. We will keep you apprised of what that looks like. But we have, like Melissa had mentioned earlier, a workforce grant that could cover some of that and those cuts, that we're not going to suffer those losses. The other parts of the article extended into other boards. I don't have any other points to discuss at this point.
Thank you, Jen. And you know, I will take the responsibility for extending this meeting beyond our 1:30 cutoff time. I knew this topic had been advanced by Dr. Severson, and it's an important issue. Even Jamie's raised the issue today of what's the morale? How are our people? How happy are we? But this is really important stuff. Jen, you've been here for 5 months. Okay? A year from now, you won't have that set. How many months? Okay. When this was done, it was 5 months. But a year from now, you won't have that same situation. If this is now under your reign and your leadership, and my suggestion is we keep going forward. We keep our finger on the pulse of these topics. We pay attention to our people, our staff, our morale, our employee numbers, what their challenges and their needs are. We support you and each other. And as a new chair, but as chair, don't hesitate letting me know. I will fight for the board's views and concerns. And thank you for addressing these issues, and don't be dodging them. And I want to also acknowledge the media for helping us be aware of community concerns. That's just me, okay? But this is really, really important stuff is our people. I'll leave it at that. Dr. Severson, did you? Okay, anybody else? My apologies for extending this meeting. Jen, did you have something else?
It was brought to my attention by some of our staff actually in-house that there's a lot of conversation happening around us as to how we're doing at Fargo-Cass Public Health without actually having a lot of conversations with us at Fargo-Cass Public Health about how we're doing. The staff that had mentioned this said that we are doing well, and actually they all wanted to come, and I'm like, that's probably not the best public use of our time. But it does feel good. It does feel like the departments are doing well. So if you would like to have conversations with our staff, please do.
The door's open.
Absolutely.
And we learn always. All right, any public comment out there? Has anybody signed up for public comment?
No.
All right. On that note, our next meeting will be July 11th. I didn't anticipate today that I'd be walking out as chair, but I'll do my level best. I really wouldn't have minded if Bernie would have done it. But I will represent you and do my level best to be a good board leader. So on that note, we stand adjourned.